Welcome to our 3 Minute Therapy podcast with me, Dr. Michael Edelstein, a clinical psychologist, and my co host, Mick Berry, sitting there in front of the drums. And we discuss subjects related to REBT, rational emotive behavior therapy, excuse me, and rational emotive behavior therapy is a type of therapy developed by Albert Ellis in the 1950s that revolutionized the course and approach to psychotherapy. And the idea there is that our emotions don't come from situations like our childhood or people treating us badly or other unfortunate things in our life, but rather our emotions come from our thinking about situations, and that's a powerful idea. It's good news because if you don't like how you're feeling, if you're feeling anxious, depressed, or angry, you can change your emotions by changing your thinking. Mick, did you want to say more about that?
Well, not only can you change your emotions by changing your thinking, your emotions are connected to your thinking. You really have no choice about changing your emotions connected to your thinking other than not changing them. But your emotions and your thinking are intimately connected. And it's good to learn about how your emotions arise and what causes them. And REBT teaches people that our emotions and our thinking are intimately connected, and that the way we think determines how we feel emotionally.
Yeah, exactly. And the particular type of emotions that we look at are emotions that are connected to our thinking and a thinking in terms of demands. Must, should, supposed to's, have to's, demands we put on ourselves, others, and situations. So if you want to change your disturbed emotions, look for your must, look for your should, and question it, challenge it, uproot it, and show yourself. Musts are fictional. There's nothing that must be the way you want it to be. Uh, Reality is reality. You don't run the universe. You don't control um, uh, a lot of things in your life, although you have influence on things. And so look for those demands and uproot them, and you'll get over a lot of your disturbed emotions. And today we're going to apply it to a physical pain and injury and illness. And when people disturb themselves about having depression or anxiety or guilt about their pain or illness or injuries, they have a variety of musts. And few of those might be, I must not feel this way. We call that low frustration tolerance. It is very, very frustrating to be sick or ill, but it's not. There's no reason why it must be other than it is. I must progress rapidly. I should have avoided getting this injury or illness in the first place. I must not be a burden on others who are taking care of me and impacted by this in my life. And also, I have actually a client now who feels shame about being disabled, and she doesn't want to walk outside with a cane or a walker because she's over concerned about what other people think of her. And also, sometimes a way to deal with illness is by taking medication, and people sometimes procrastinate on taking their medication or are not too reliable in doing that. Mick, did you have any other thoughts there?
Well, there is the occurrence of terminal illness, and REBT can even help people with terminal illness, which is about, I would say, the worst illness to have, and depending on how painful some illness may be. But what REBT does offer people is how to make a situation as tolerable as possible by not compounding the physical pain and the physical difficulty and great inconvenience with emotional problems on top of that. REBT cannot remove physical pain, but by not compounding it with emotional distress on top of it, then somebody is able to deal with the physical pain in a more efficient way and do and have the mental capacity to see about, well, what can I do to get rid of this physical pain? What can I do to get rid of this physical illness? Without emotional distress, we're much freer to address the particular problem that we have. When we add emotional distress on top of a physical problem, like an illness, then we make it more difficult to overcome the illness if the illness can be overcome. And there are people who have terminal illnesses that take it upon themselves that I'm going to enjoy the last 6 months of my life the best way that I can. And one of the factors in that is I'm not going to tell myself that this must not be occurring. I remember Arthur Ashe when he was diagnosed with, he was HIV positive from a blood transfusion. And an interviewer asked him, "Do you ever ask yourself, why me?" And Arthur Ashe said, "Why not me?" And I thought that was, now, I don't think he had any training in REBT, but that's a clear example of thinking about it in a way which would be helpful by saying, "Why not me?" Arthur Ashe was saying there's no reason this should not be occurring.
Yeah. Is that Arthur Ashe, the tennis player?
Arthur Ashe, the tennis player, yes.
Uh-huh. Very good. Very good. Yeah.
And this interviewer cited in one short sentence, Arthur Ashe took away, gave everybody a secret for ending self-pity.
Hmm. Yeah, that's another point that sometimes comes up with physical pain and with illness is self-pity. This shouldn't have happened to me. I didn't deserve it. Or poor me. I can't face this pain.
Okay.
Okay, very good, very good. Uh, and thank you, Chris Rossini, our technical engineer. Comment below if you have questions, you'd like to volunteer. We have volunteers once in a rare while. And give us a thumbs up if you like this. Suggest subjects for future podcasts. And again, my co-host here is Mick Berry, REBT expert. I'm Michael Edelstein, clinical psychologist with the website 3minutetherapy.com. And subscribe to the 3 Minute Therapy podcast to stay on. To do what, Mick?
To stay on the rational side of life, and I'll add to stay on the rational side of illness.
Yeah, yeah, great. Very good. Thank you.